Congress since inception, iWeigh is committed to ongoing efforts to make it illegal to promote and sell diet products to minors. Working closely with Instagram and Facebook, Jameela and iWeigh helped shape their global policy change, restricting the promotion of harmful products. To further these endeavors, iWeigh is working in collaboration with Striped, based at the Harvard Chan School for Public Health, to promote research, education, and advocacy to lawmakers. Thank you, Jameela, for being with us.
Thank you so much for having me. Hello, everyone, and also thank you, Athena, for that for those lovely words. So, dear members of Congress and staff and those impacted by eating disorders here today from around the United States, thank you. Thank you so much for having me. I just want to start by shouting out the work of Shavise Turner. I want to honour her exemplary activism in this field that's gotten us so far, and today certainly wouldn't be happening without her. I speak before you not only as an advocate, but as a survivor of a life spent battling the demons of an eating disorder. Mine started at school. I was 11 years old when girls in my school first became conscious of their size, and very quickly amongst us, thinner was established as a superior status within the class, with fatness being instantly labelled as weak, lazy, and worthy of incessant ridicule. Being one of the chubbier kids in my school, this promptly led to my starving myself for a large portion of my teens, and filling my prepubescent body with laxatives and unregulated diet products, losing me sleep, energy, damaging my bones, my reproductive system, my digestive system, my adrenals, my teeth, and my kidneys, not to mention the fact that it robbed me of my entire youth. And as many of us here know, once eating disorders start, they are extremely difficult to reverse, due to a culture that consistently reaffirms an irrational fear of fat and an obsession with thinness, regardless of how many dangerous things you do to maintain a low weight. And I'm sad to say that it took me the following 20 years to escape from the grips of that eating disorder, as we learned from Athena, an all too common story amongst survivors. And I am one of the lucky ones, because my generation didn't grow up with social media. Knowing that preventative care, guidance, and education could likely have saved me from what has cost me 2 decades of happy memories and has harmed my mental health and physical health irrevocably for the long term is why I am so passionate about this bill, and we really have to act now. We are in the middle of a national emergency beyond just the COVID-19 pandemic. We are at an all-time high of disordered eating, self-harm, cosmetic surgery, and suicide in teenagers. And there is no coincidence that this correlates with the rise of social media and diet culture and the profound and terrifying impact on the self-image of our youth. They are being bombarded with digitally enhanced photographs showing unrealistic beauty and body ideals. They are being given extreme weight loss tips and eating disordered rhetoric by irresponsible celebrities and influencers. They are constantly being targeted for products that involve medically unsupervised extreme weight loss methods, which have lasting effects, often undeclared in their adverts, on the mental and physical health of the young person taking them. With algorithms on social media literally chasing down kids to flog them this content, we have to accept that it is now finding its way offline and into their homes, and notably into their classrooms. Weight-based bullying in schools is a crisis for the development of someone in their most vulnerable period of emotional growth. Parents and schools appear to be unaware of this and its impact, and therefore ineffective in combating the damage done. It is vital that this changes, as we have the opportunity to save the lives and the future mental health of so many children by addressing this as early as possible. Please hear me and take me seriously in that 40 to 60% of children ages 6 to 12 are concerned about their weight or becoming too fat, and this concern often endures through life. Over 30 million Americans will be affected by an eating disorder in their lifetime. 1 million adolescents every month engage in weight control behaviors which are risk factors for an onset of an eating disorder. It is the second highest mortality rate of any mental illness, topped only by opioid use disorder, and yet somehow it is still not considered a national health crisis or cause for mass concern and education. Children as young as 4 are now being hospitalized for disordered eating. Up to 40% of above average weight boys and girls are teased by peers or family members about their size, which has hugely detrimental impacts on their mental health. We cannot deny that we live within a society in which it is frankly open season on fat bodies. They are one of the only groups where bullying, harassment, and targeted abuse is not condemned or even addressed as inappropriate and dangerous. We forget that this harms all people of all sizes and all ages. This toxic and unacceptable messaging and societal behavior seeps into the consciousness of impressionable people who do not deserve to be made miserable over something as wholly unimportant as their external appearance. Shame has never been the answer to mental or physical health. Education, tolerance, and empathy are. Happy children grow up to make better and more intuitive decisions regarding their health. Schools need to do more to expose the dishonesty of advertising and social media to create true literacy on the tactics used to push unrealistic body ideals. They need to educate children on nutrition and the long-term damage of fad diets and unregulated diet and detox products sold over the counter or on the internet. They need to crack down on weight-based discrimination and understand that their inaction on this is costing people their happiness and potential as human beings, as weight does not determine your ability in most areas of life. Understand that school shapes the future society. These children with poor understanding of actual mental and physical health and the detrimental impacts of discrimination grow up to be the adults who utilize the stigma to harm themselves or others, and not to mention the likelihood that they will pass this misinformation on to the next generation that follows them. Also, please understand that this is not just a moral plea for kindness, tolerance, and humanity. It is also a promise that to implement this bill would contribute to less strain upon the healthcare system in this country. With such an overwhelming amount of discourse around affordable care, it only makes financial sense to work on eating disorders preventatively rather than just continuing to roll the dice on millions of young American lives. We can stop this cycle of harm, ignorance, and negligence now, before we lose more children to the deadly impact of weight stigma. They need us, and it is our duty to stop this harm that we can now see so clearly. Thank you.
Thank you so much, Jameela, for your words and all your contributions to this important work.